So, hi everybody. This is the third and final video explaining different dimensions of the training that is going to happen in Macau during October and November. So this video is based on feedback we've been getting from people about questions that they have about how, for example, the training connects to the notion of self as related to personality disorders and traumatization of an individual. So that's what I want to talk about now. Okay, so first off, the self, whether it's an Eastern or Western or Chinese or American version of self, is primarily a construct, meaning it's constructed of different materials and interpersonal interactions that one has with caregivers, family members, authority figures, and representatives of society. So anything that can be constructed by a human being can be deconstructed by certain life events, which in my definition I call traumatic. Anything that deconstructs the self-structure of an individual or their worldview is traumatic. So trauma has an impact on both the intrapsychic and internal representations of an individual, also their self-image, what they hold in their mind as who they are, and also can break apart how they organize reality, which is something they've been taught by family and society. Okay. So if you can understand what a self is, then you can, and a worldview, then you can understand how trauma impacts people. Why certain events affect people in different ways. It's because people are organized differently in terms of their self-structure or their identity and their versions of human beings or humanity and reality. Okay. Personality disorders now, this is a very complicated topic. And I don't know if I can do justice to the complexity of personality disorders. But personality disorders usually represent poorly integrated versions of self. And these poorly integrated versions of self are based on developmental failures at different developmental stages and/or certain traumatic injuries that people incur while the self is in formation or being evolving. So the most common ones that clinicians run into are a schizoid personality, a narcissistic or borderline. Now, developmentally, it's schizoid, borderline, narcissistic. Narcissistic being the most evolved or developed self-structure. So schizoid self-structure basically is very apprehensive and uncomfortable trusting or connecting with other human beings, which is an essential element of self-development. You have to internalize elements of your relationships with other people to form a self. Borderline individual has a lot of difficulties separating and differentiating from another. Typically, a child and a caregiver are fused psychologically. Borderline person is punished for clinging and punished for trying to emancipate and become independent. So either way they go, they are punished by their caregiver. So they're very apprehensive about separating and having another separate from them. They're rewarded for staying fused, and they're usually punished for any kind of separation. A person with a narcissistic personality disorder, their self-structure is organized around using another as a self-object and not having developed object constancy or person constancy, so that they can see that another person is separate, unique, different, and has their own autonomy and their own right to self-determination. A narcissistic person would tend to co-opt or use that person as a component of their own self-structure. So, again, to reiterate the connection between self-structure, trauma, and personality disorders, self-structures are interpersonal and social constructs that come out of relationships that children have with other human beings. And these relationships give them feedback, care, love, and other psychic materials that help them to organize a self in conjunction with social, societal values and images and role models that people can build a self around. Personality disorders represent partial integrations of self or failures in this self-evolution process or self-development process. Trauma, especially relational forms of trauma, are the single biggest factor that breaks apart the self and or disintegrates it, damages it, or renders it inoperative or relatively inoperative, like personality disorders. So, if we can understand the social construction of the Western self and the Chinese self, then we'll understand that certain traumatic events break apart or throw into question, damage, or destroy certain self-structures that people have, whether they're Chinese or American. On a deeper level, trauma has to be very powerful to make the interpsychic organization of self break apart. So this would involve long-term trauma, where people end up with dissociative disorders, where the self fragments literally on the intrapsychic level. It breaks into pieces or never integrates. We're not sure if we start integrated and break apart, or we become integrated and then break apart. But long-term repetitive trauma, especially from parents involving incest, emotional abuse, and neglect and abandonment and betrayal, can literally break apart or disintegrate the self on the intrapsychic level. So in these workshops and trainings, I'm going to first explain or describe what the social construction of the Chinese and the Western self is. Then I'm going to talk about the intrapsychic construction of both the Western and the Chinese self, their similarities and differences on both levels. And I will occasionally bring in how traumatic events can deconstruct either or both of these levels. And depending on the degree of destruction or disintegration, you end up with personality disorders or you end up with psychosis. That's the extreme end of traumatic impact on a self-structure. Okay? So I hope this helps. I hope this clarifies some of your questions. And I hope those of you who come bring more questions like this, and we'll discuss them and clarify and go deeper in the actual training. Okay? So look forward to seeing you, and till then.